If your Audi A1 key fob isn't responding or the car isn't recognizing the key, it likely needs a new battery. The Audi A1 key fob uses a CR232 3-volt lithium battery available online or at stores like AutoZone. To open, locate the key ring slot and gently pry the two halves apart using a plastic pry tool. Avoid metal tools to prevent damage. Remove the old battery, noting the polarity, positive side up. Insert the new CR232 battery with correct orientation. Reassemble the case, snapping the clips back into place. Test the remote functions near your vehicle to ensure it's working. This DIY saves $50 to $150 compared to dealership services. Be careful when opening the case, as forcing it can cause irreversible damage. If your Audi A1 key fob doesn't work after battery replacement, check for corrosion on the battery contacts. Clean them with isopropyl alcohol and a cotton swab. If problems persist, reprogram the key fob via the car's MMI system by holding the unlock button while turning the ignition on. Use OEM spec batteries to avoid intermittent remote issues. Extreme temperatures or frequent use can shorten battery life to 6 to 12 months. A hairdryer at low heat, under 50 degrees Celsius, can help loosen stuck clips if the case is difficult to open. Some users report software-related fixes via the vehicle's MMI system can resolve issues post-battery change. For complex problems, consider professional reprogramming.